Question 1. Pharmacology and toxicology. Drug classification and uses. Which of the following statements regarding the use of antibiotics in veterinary medicine is accurate? A. Antibiotics are used for the treatment of viral infections in both humans and animals. B. Broad-spectrum antibiotics are preferred in cases of undiagnosed bacterial infections to prevent resistance. C. Antibiotics should always be administered until the full course is completed, even if symptoms resolve early. D. Overuse of antibiotics can lead to antibiotic resistance, but this is not a concern in veterinary medicine. Answer. C. Antibiotics should always be administered until the full course is completed, even if symptoms resolve early. Explanation. In veterinary medicine, as in human medicine, it's essential that antibiotics are administered as prescribed, even if symptoms improve before the full course is completed. This ensures that the infection is completely eradicated and reduces the risk of developing resistant bacteria. Broad-spectrum antibiotics, option B, are always preferred, as they can lead to the development of resistance over time. Antibiotics are ineffective against viral infections, option A, and overuse or misuse, option D, is a major concern contributing to antibiotic resistance, which is a growing problem in both human and veterinary medicine. Question 2. Emergency in critical care. Shock management. A 5-year-old Labrador Retriever, Max, is brought into the emergency clinic in shock after being hit by a car. Max is hypotensive, tachycardic, and has pale mucous membranes. The veterinarian suspects hypovolemic shock. What is the most appropriate initial intervention to manage Max's condition? A. Administer fluid bolus of isotonic crystalloids to correct the volume deficit. B. Begin immediate corticosteroid therapy to stabilize the cardiovascular system. C. Administer analgesics first to ensure pain control before proceeding with fluids. D. Initiate high-dose epinephrine to restore blood pressure immediately. Answer. A. Administer fluid bolus of isotonic crystalloids to correct the volume deficit. Explanation. In cases of hypovolemic shock, the initial goal is to restore circulating blood volume. This is best achieved through the administration of isotonic crystalloids, such as lactated Ringer solution, which helps to expand the vascular volume and improve perfusion. Corticosteroids, option B, are not first-line treatments for shock. While have anti-inflammatory effects, they do not address the underlying fluid loss. Pain management is important, option C, but fluid resuscitation should take priority in hypovolemic shock. High-dose epinephrine, option D, is used for specific cases of anaphylactic shock or cardiac arrest, not for hypovolemic shock. Question 3. Clinical pathology. Urinalysis. Mr. Stevens brings his 8-year-old cat Whiskers into the clinic with signs of lethargy, vomiting, and decreased appetite. The veterinarian orders a urinalysis, and the results show a specific gravity of 1.30, pH of 7.0, and the presence of protein in the urine. Based on these findings, what is the most likely interpretation of these results? A. The cat has diabetes mellitus with concurrent kidney disease. B. The cat is likely dehydrated and the proteinuria could be due to stress. C. The presence of protein suggests a urinary tract infection that needs immediate antibiotic treatment. D. The normal specific gravity and pH indicate normal renal function despite the proteinuria. Answer. B. The cat is likely dehydrated and the proteinuria could be due to stress. Explanation. The presence of protein in the urine along with a relatively concentrated urine specific gravity of 1.30 suggests that the cat may be experiencing dehydration. In cases of dehydration, the kidneys conserve water, which may lead to a higher specific gravity. Stress-induced proteinuria can occur, especially in sick or stressed cats. Does not necessarily indicate a primary kidney disease or urinary tract infection, UT. Diabetes mellitus, option A, is characterized by glucosuria, which is not indicated in this case. UTs are often associated with more pronounced clinical signs, such as increased frequency of urination, and are not directly linked to proteinuria alone, option C. Normal renal function would not be expected with the presence of protein, option D, as it typically suggests an issue with kidney filtration. Question 4. Animal nursing. Fluid therapy. A 4-year-old German Shepherd, Bella, is admitted to the clinic for surgery. The veterinarian has determined that Bella is mildly dehydrated with a body condition score of 4/9. Blood work reveals elevated levels of creatinine and BUN, suggesting a possible kidney issue. What is the best approach to manage Bella's fluid therapy in preparation for surgery? A. Administer isotonic crystalloids at moderate rate as dehydration is mild and monitor kidney function postoperatively. B. Administer hypertonic saline immediately to correct dehydration as it will rapidly increase circulating volume. C. Withhold fluids before surgery to avoid fluid overload during the procedure. D. Administer balanced electrolyte solution at slow rate to ensure gradual rehydration considering the concern. Answer: D. Administer balanced electrolyte solution at a slow rate to ensure gradual rehydration considering the renal concern. Explanation: in Bella's case, where kidney function is compromised as indicated by elevated creatinine and BUN, it is critical to avoid any aggressive fluid therapy that could further stress the kidneys. Balanced electrolyte solution, such as lactated Ringer's solution, should be administered slowly to provide hydration without overloading the kidneys. While isotonic crystalloids, option A, are generally suitable for mild dehydration, caution is needed due to Bella's renal concerns. Hypertonic saline, option B, is not recommended in this situation because it can cause further electrolyte imbalances. Withholding fluids, option C, could worsen dehydration and is contraindicated, especially in the perioperative period. Question 5. Surgical nursing. Aseptic technique and sterilization. During a routine space surgery, the surgical technician realizes that one of the surgical instruments was not properly sterilized and it was used to incise the abdomen. What steps should the surgical team take to prevent infection and manage the situation? A. Immediately discontinue the surgery, remove all contaminated instruments, and notify the veterinarian to start prophylactic antibiotics. B. Continue with the surgery, as the risk of infection is minimal in a routine spay procedure. C. Clean and disinfect the instrument immediately and continue the surgery after re-sterilizing it. D. Notify the veterinarian and proceed with the surgery, but sterilization protocols should be reviewed after the procedure. Answer: A. Immediately discontinue the surgery, remove all contaminated instruments, and notify the veterinarian to start prophylactic antibiotics. Explanation: sterility is paramount in any surgical procedure to reduce the risk of post-operative infections. If a non-sterile instrument has been used, it poses a risk of introducing pathogens into the surgical site. The correct response is to immediately discontinue the surgery, remove contaminated instruments, and notify the veterinarian to consider starting prophylactic antibiotics. Continuing the surgery, option B, without addressing the contamination would put the patient at significant risk. Simply cleaning and reusing the instrument, option C, would not be effective in ensuring sterility and could exacerbate the risk of infection. Option D is not sufficient, as the sterilization issue should be addressed immediately during the procedure, not afterward. Question 6. Emergency and critical care. Trauma management. A 10-year-old cat, Tinker, has been in a severe motor vehicle accident. Upon arrival at the emergency clinic, the veterinarian finds that Tinker is in hypovolemic shock with low blood pressure, elevated heart rate, and cold extremities. The veterinarian decides to administer intravenous fluids. What is the most appropriate type of fluid to administer in this case? A. Hypertonic saline to increase circulating volume quickly and improve tissue perfusion. B. Isotonic crystalloids, such as lactated Ringer's solution, to replace lost fluids and restore blood volume. C. Colloids, like Hetistark, to increase blood volume and improve circulation in critically ill patient. D. Normal saline only, as it is more cost-effective and sufficient for initial resuscitation. Answer: B. Isotonic crystalloids, such as lactated Ringer's solution, to replace lost fluids and restore blood volume. Explanation: in cases of hypovolemic shock, isotonic crystalloids, e.g. lactated Ringer's solution, are the most appropriate initial fluid choice. They help to restore circulating volume and improve perfusion to vital organs. Hypertonic saline, option A, may be used in some cases to rapidly expand volume, but it can also cause complications such as electrolyte imbalances, and it is typically not the first choice for initial resuscitation. Colloids, option C, such as Hetistark, are more commonly used for maintaining blood volume in situations where crystalloids are insufficient, but they are not typically the first line of treatment in hypovolemic shock. Normal saline, option D, is isotonic but lacks the additional electrum found in lactated Ringer's solution, which helps to more closely mimic the body's natural fluid balance. Question 7. Clinical pathology. Hematology. A dog presents with symptoms of lethargy, pale gums, and decreased appetite. A complete blood count CBC reveals a marked decrease in red blood cell RBC, hemoglobin, and hematocrit. What is the most likely diagnosis for this dog, and what is the next step in managing the condition? A. Hemolytic anemia. Immediate administration of corticosteroids and blood transfusion. B. Iron deficiency anemia. Oral iron supplementation and dietary changes. C. Chronic kidney disease, a supportive therapy and possible erythropoietin administration. D. Acute blood loss anemia, a fluid therapy and blood transfusion if necessary. Answer: D. Acute blood loss anemia, a fluid therapy and blood transfusion if necessary. Explanation: the clinical presentation and CBC findings suggest acute blood loss anemia. In cases of acute hemorrhage, it is critical to address the underlying cause of blood loss and support the animal with appropriate fluid therapy and, if necessary, a blood transfusion. Hemolytic anemia, option A, is characterized by the destruction of erythrocytes, not loss, and typically presents with other signs such as jaundice. Iron deficiency anemia, option B, is more commonly a chronic condition and is often related to dietary insufficiency or chronic blood loss. Chronic kidney disease, option C, can cause anemia due to decreased erythropoietin production, but it would not present acutely with such severe decreases in RBC, hemoglobin, and hematocrit. Question 8. Anesthesia and analgesia. Pain management. A 3-year-old Labrador Retriever, Molly, is recovering from a soft tissue surgery. The veterinarian is concerned about her pain management postoperatively. Which of the following pain management techniques should be employed to ensure adequate analgesia while minimizing the risks of opioid overuse? A. Use a combination of NSAIDs and opioids, but avoid any adjunct therapies. B. Administer local anesthetics at the surgical site and provide multimodal analgesia, including NSAIDs, opioids, and alpha-2 agonists. C. Rely solely on opioids for pain control, as they are the most effective analgesics. D. Provide no additional analgesics, as postoperative pain typically resolves without medication. Answer: B. Administer local anesthetics at the surgical site and provide multimodal analgesia, including NSAIDs, opioids, and alpha-2 agonists. Explanation: effective postoperative pain management should involve a multimodal approach that utilizes different classes of drugs to target pain through various mechanisms. Local anesthetics at the surgical site provide immediate pain relief and can reduce the need for systemic analgesics. The NSAIDs, opioids, and alpha-2 agonists, option B, provides comprehensive pain control while minimizing the overuse of any single drug, especially opioids, which can have side effects like sedation and respiratory depression. Relying solely on opioids, option C, is not recommended due to the risk of opioid overuse and adverse effects. Providing no analgesics, option D, is unethical and will likely result in unnecessary suffering for the animal. Question 9. Behavioral medicine, aggression and aggressive behavior control. A 6-year-old pit bull, Duke, has shown signs of aggression towards other dogs during walks, and recently he became aggressive towards a visitor at his owner's home. The owner is concerned and asks for advice. Which of the following is the best initial approach to managing Duke's aggression? A. Begin immediate behavior modification with aversive techniques to deter aggressive behavior. B. Recommend thorough veterinary examination to rule out underlying medical causes for aggression, followed by a behavior modification plan. C. Advise the owner to rehome the dog to avoid future incidents of aggression. D. Suggest an immediate increase in the dog's physical exercise to decrease aggression. Answer: B. Recommend a thorough veterinary examination to rule out underlying medical causes for aggression, followed by a behavior modification plan. Explanation: aggression in dogs can often be caused by medical issues such as pain, hormonal imbalances, or neurological conditions. A veterinary examination should be the first step to rule out any underlying health problems that may be contributing to the aggression. Once medical causes are out, a behavior modification plan can be created. Aversive techniques, option A, should be avoided as they can increase fear and anxiety, exacerbating the aggression. Rehoming, option C, should not be the first solution, as many cases of aggression can be managed with proper care and training. Increasing exercise, option D, may help with behavioral issues, but it should not be relied upon as the sole solution. Question 10. Veterinary hospital management. Client communication. A pet owner, Mrs. Clark, is upset because her dog has been diagnosed with a chronic illness that requires ongoing treatment. She is confused about the treatment plan and feels overwhelmed by the medical terminology used. What is the best approach for the veterinary technician to take in this situation? A. Explain the treatment plan in simple terms, ensure the client understands the next steps, and provide written instructions for reference. B. Reassure the client that everything will be fine and leave the decision-making to the veterinarian. C. Advise the client to visit an external specialist to ensure the treatment plan is appropriate. D. Encourage the client to accept the treatment plan without further discussion as it is the best course of action. Answer A. Explain the treatment plan in simple terms, ensure the client understands the next steps, and provide written instructions for reference. Explanation. Effective communication is a critical part of veterinary care. The veterinary technician should take the time to explain the treatment plan in simple, clear terms to ensure the client understands the condition, the proposed treatments, and the next steps. Providing written instructions can be a help. Reference for the client as they process the information. This approach not only alleviates confusion but also empowers the client to make informed decisions about their pet's care, reassuring the client, option B, without addressing their concerns or explaining the details of the plan may lead to further confusion. Recommending an external specialist, option C, may be necessary in some cases but should not be the first suggestion unless warranted. Situation. Encouraging the client to accept the plan without discussion, option D, can lead to dissatisfaction and a breakdown in trust between the veterinary team and the client. Question 11. A 3-year-old cat named Whiskers is presented to your clinic with a history of vomiting, lethargy, and a reduced appetite. Upon physical examination, you find mild dehydration, a soft, distended abdomen, and slightly elevated heart rate. A complete blood count, CBC, and biochemical profile indicate mild azotemia, elevated blood urea, nitrogen, and creatinine levels. The veterinarian suspects acute kid injury. A key. What is the most appropriate course of action for Whiskers? A. Administer Roman-Uidza to correct dehydration and monitor renal function closely. B. Begin antibiotic therapy to prevent urinary tract infection. C. Recommend a renal biopsy to confirm the diagnosis immediately. D. Wait for further laboratory results before initiating any treatments. Answer A. Administer Roman-Uidza to correct dehydration and monitor renal function closely. Explanation. In a case of suspected acute kidney injury, the immediate priority is to stabilize the patient by addressing dehydration and electrolyte imbalances through intravenous Roman-Uidza therapy. The mild azotemia seen in the blood work is a key indicator of kidney dysfunction, and fluid therapy helps to support renal perfusion and function. Antibiotics, option B, would only be indicated if there was evidence of infection, which is not suggested here. A renal biopsy, option C, is typically unnecessary in the acute phase, and waiting for further results, option D, could delay appropriate treatment. Monitoring kidney function through serial blood work and adjusting treatment as needed is essential in managing a key. Question 12. During a routine dental cleaning for a 5-year-old boxer dog, the veterinarian notices significant periodontal disease, including gingival recession and tooth mobility. Radiographs reveal bone loss around the roots of several teeth. What is the most appropriate next step in the management of this condition? A. Perform extractions of the affected teeth and provide post-operative care with antibiotics. B. Administer a local anesthetic and reapply fluoride treatment to the teeth. C. Advise the client to wait for further progression of the disease before taking action. D. Recommend a second opinion from a veterinary dental specialist. Answer A. Perform extractions of the affected teeth and provide post-operative care with antibiotics. Explanation. In cases of advanced periodontal disease with bone loss and tooth mobility, the most appropriate treatment option is often the extraction of severely affected teeth. This is necessary to prevent pain, further infection, and systemic complications such as bacteremia. After extractions, appropriate post-operative care and antibiotics, if infection is present, are important to prevent complications. Reapplying fluoride, option B, is not sufficient to address the underlying disease in cases of severe periodontal disease. Waiting for further progression, option C, could result in significant discomfort and systemic illness. A second opinion, option D, may be warranted if there is uncertainty about the diagnosis, treatment, but it is not the first step in this clear case of advanced periodontal disease. Question 13. A 10-year-old Labrador Retriever named Bailey is brought in for an emergency evaluation after ingesting an unknown amount of chocolate. The owner reports that the dog ate a large amount of dark chocolate while unsupervised in the kitchen. Bailey is now showing signs of restlessness, vomiting, and rapid breathing. What is the most appropriate initial treatment for this situation? A. Administer activated charcoal to absorb theobramine and initiate Roman-Uid therapy. B. Induce vomiting using a hydrogen peroxide solution and then administer activated charcoal. C. Perform an abdominal radiograph to determine the amount of chocolate ingested. D. Wait for the dog to pass the chocolate naturally and monitor for signs of distress. Answer A. Administer activated charcoal to absorb theobramine and initiate Roman-Uid therapy. Explanation: chocolate toxicity in dogs is primarily due to theobramine, a stimulant that can cause vomiting, restlessness, and tachypnea. The first step in managing this type of poisoning is administering activated charcoal to reduce further absorption of theobramine. Roman-Uid therapy is essential to support renal function and correct any electrolyte imbalances. Inducing vomiting, option B, may be an appropriate step in some cases, but it should be done carefully to avoid aspiration. Radiographs, option C, are generally not necessary unless the quantity of chocolate ingested is unclear, and waiting for natural passage, option D, is not recommended because the toxicity could worsen without intervention. Question 14. A 6-month-old puppy named Bella presents with a history of diarrhea, vomiting, and lethargy for the past 24 hours. On examination, Bella is febrile and has a history of incomplete vaccinations. What is the most likely diagnosis and how should you proceed with treatment? A. Parvovirus infection. Administer supportive care with Roman-Uids and antiemetics. B. Giardia infection. Administer a deworming agent and oral antibiotics. C. Intestinal obstruction. Recommend immediate abdominal surgery. D. Food intolerance. Recommend a bland diet and monitor for improvement. Answer A. Parvovirus infection. Administer supportive care with Roman-Uid and antiemetics. Explanation: in a young, unvaccinated puppy presenting with vomiting, diarrhea, and fever, parvovirus infection is the most likely diagnosis. Parvovirus causes severe gastrointestinal and immune system damage, leading to dehydration, electrolyte imbalances, and a compromised immune response. The mainstay of treatment is supportive care, including fluids, antiemetics, and possibly antibiotics to prevent secondary infections. Giardia, option B, is less likely given the acute presentation and lack of a specific history. Intestinal obstruction, option C, could cause similar symptoms but would likely present with a different physical examination, e.g. abdominal pain or bloating. Food intolerance, option D, is less likely given the severity of symptoms and the lack of any recent diet. Question 15. A 2-year-old mixed-breed dog named Max is presented with a history of increased thirst, urination, and weight loss despite a good appetite. On examination, Max is slightly underweight and his coat is dull. Blood work reveals hypoglycemia, elevated liver enzymes, and increased cholesterol. What condition do these findings most likely indicate, and what should be your next step? A. Diabetes mellitus. Initiate insulin therapy and dietary changes. B. Cushing's disease. Begin treatment with trilostane. C. Hypothyroidism. Start thyroxine supplementation. D. Acute pancreatitis. Begin Roman-Uids and pain management. Answer A. Diabetes mellitus. Initiate insulin therapy and dietary changes. Explanation: the clinical signs of increased thirst, urination, weight loss despite a good appetite combined with the blood work showing hypoglycemia and elevated liver enzymes are highly suggestive of diabetes mellitus. The most appropriate next step is to initiate insulin therapy and dietary changes to manage blood glucose levels. Cushing's disease, option B, also cause increased thirst and urination, but it would typically be associated with additional signs like pot-bellied appearance or hair loss. Hypothyroidism, option C, is unlikely given the weight loss and other clinical signs. Acute pancreatitis, option D, could present with some similar signs, but would typically cause more acute gastrointestinal symptoms such as vomiting or abdominal pain. Question 16. A 3-year-old Siamese cat named Luna presents with coughing, wheezing, and a history of intermittent respiratory distress. Luna's physical exam shows nasal discharge, mild wheezing, and increased respiratory effort. Thoracic radiographs reveal signs of bronchial patterning. What is the most likely diagnosis and how should it be managed? A. Feline asthma. Initiate bronchodilator therapy and corticosteroids. B. Upper respiratory infection. Administer antibiotics and antihistamines. C. Heartworm disease. Begin treatment with meloxicam. D. Pneumonia. Recommend broad-spectrum antibiotics and hospitalization. Answer A. Feline asthma. Initiate bronchodilator therapy and corticosteroids. Explanation: Feline asthma is the most likely diagnosis based on the clinical signs of coughing, wheezing, and increased respiratory effort, along with the bronchial patterning seen on radiographs. Treatment typically involves bronchodilators, e.g., albuterol and corticosteroids to reduce inflammation in the airways. An upper respiratory infection, option B, is less likely given the lack of fever or other infectious signs. Heartworm disease, option C, could cause respiratory symptoms, but it is rare in cats and would typically present with more severe signs of heart failure. Pneumonia, option D, is unlikely in the absence of fever and a more severe infection. Question 17. A 9-year-old German Shepherd named Max is presented for a routine wellness exam. On examination, you notice that Max has a stiff, slow gait, particularly in the hind limbs. The owner reports that Max has been less willing to go for walks and seems to be in discomfort when rising from a resting position. Radiographs reveal severe hip dysplasia. What is the most appropriate management plan for Max? A. Start Max on a course of NSAIDs and recommend weight management. B. Recommend immediate hip replacement surgery. C. Administer corticosteroids to manage inflammation in the hips. D. Begin physical therapy and chiropractic care. Answer A. Start Max on a course of NSAIDs and recommend weight management. Explanation. For a dog with hip dysplasia, especially an older dog with clinical signs of discomfort and reduced activity, the most appropriate first step in management is conservative treatment, including NSAIDs to control pain and inflammation, along with weight management to reduce stress on the joints. Hip replacement, option B, is an option but would generally only be considered for younger dogs with severe progressive symptoms who are not responding to conservative treatment. Corticosteroids, option C, can be used for inflammation but should be avoided for long-term management of joint disease due to potential side effects. Physical therapy, option D, could be beneficial but is not a first-line treatment. Question 18. A 7-year-old cat named Smokey presents with a history of vomiting, lethargy, and a lack of appetite for the past 24 hours. On examination, Smokey is jaundiced and a blood test reveals elevated liver enzymes. Ultrasound imaging of the abdomen shows a large, irregular mass in the liver. What is the most likely diagnosis and what is the next step in the management of Smokey? A. Hepatic carcinoma, recommend surgical removal of the mass. B. Feline hepatic lipidosis, initiate aggressive nutritional support and fluids. C. Gallbladder mucosal, recommend surgical removal of the gallbladder. D. Chronic hepatitis, begin corticosteroid therapy. Answer B. Feline hepatic lipidosis, initiate aggressive nutritional support and fluids. Explanation. Feline hepatic lipidosis is a common cause of jaundice and liver enzyme elevation in cats. It often occurs in overweight cats that experience anorexia or stress, leading to the accumulation of fat in the liver. The most appropriate management involves aggressive nutritional support, e.g., feeding tubes, to reverse the condition. Correct dehydration. Hepatic carcinoma, option A, could present with a mass, but it is less likely without further diagnostic confirmation. Gallbladder mucosal, option C, can also cause jaundice but would not typically present with such severe liver enzyme elevations. Chronic hepatitis, option D, could be a differential diagnosis but would not explain the rapid onset of signs seen in this case. Question 19. A 4-year-old beagle named Daisy presents with a 2-day history of vomiting, diarrhea, and abdominal discomfort. On examination, Daisy has a low-grade fever and appears lethargic. Abdominal radiographs reveal a distended small intestine with gas-filled loops. What is the most likely diagnosis and how should it be managed? A. Gastric dilatation valvular GDV, recommend emergency surgery. B. Intestinal obstruction, recommend surgery to remove the obstruction. C. Acute pancreatitis, begin supportive care with Romantids and pain management. D. Infectious gastroenteritis, recommend supportive care and antiemetics. Answer B. Intestinal obstruction, recommend surgery to remove the obstruction. Explanation. The presence of distended small intestine loops on radiographs is characteristic of intestinal obstruction, which could be caused by a foreign body mass or other intestinal issue. Surgery is typically necessary to remove the obstruction and prevent further complications such as bowel perforation or necrosis. Gastric dilatation valvular GDV, option A, typically cause a distended stomach and is a more acute emergency, usually associated with larger breed dogs. Acute pancreatitis, option C, could cause similar clinical signs, but it is usually diagnosed with additional laboratory tests, and abdominal radiographs would not show the same findings as an obstruction. Infectious gastroenteritis option D could also present with vomiting and diarrhea, but the radiographic evidence of distended small intestine points more strongly toward an obstruction. Question 20. A 5-year-old Rottweiler named Duke is presented with a history of progressive lameness in the left hind limb. The owner reports that Duke has had difficulty rising after resting and seems to be favoring the leg during walks. On examination, there is joint pain on palpation of the left hip. Radiographs reveal severe hip dysplasia and degenerative joint disease. What is the most appropriate treatment option for Duke? A. Start Duke on NSAIDs and recommend weight reduction to reduce joint stress. B. Perform total hip replacement surgery. C. Administer corticosteroids and recommend rest for a few weeks. D. Perform a femoral head and neck excision to relieve pain. Answer A. Start Duke on NSAIDs and recommend weight reduction to reduce joint stress. Explanation. For a dog with hip dysplasia and degenerative joint disease, conservative management is typically the first step. NSAIDs, non-steroidal anti-inflammatory drugs, help manage pain and inflammation, and weight reduction reduces stress on the affected joint, improving mobility and comfort. Total hip replacement surgery, option B, is an option for younger, more active dogs but may not be necessary unless the dog's quality of life is severely affected. Corticosteroids, option C, should be used cautiously in joint diseases as they can potentially worsen damage with long-term use. Femoral head and neck excision, option D, is surgical option that could help alleviate pain by removing the femoral head, but it is generally reserved for cases where joint replacement is not feasible. Question 21. A 4-year-old Persian cat named Bella presents for a routine wellness check. On examination, you notice that Bella's coat is dull and she has mild tremor of the forelimbs. Her weight is stable, but she has slightly enlarged thyroid gland. Blood work reveals elevated levels. What is the most likely diagnosis and how should you proceed with treatment? A. Hypothyroidism. Begin treatment with methimazole or recommend thyroidectomy. B. Hypothyroidism. Start thyroid hormone supplementation. C. Hypercalcemia. Recommend workup for parathyroid disease. D. Diabetes mellitus. Initiate insulin therapy. Answer A. Hypothyroidism. Begin treatment with methimazole or recommend thyroidectomy. Explanation. The most likely diagnosis based on the clinical signs, dull coat, tremors, and enlarged thyroid, and the blood work showing elevated T levels is hypothyroidism. Hypothyroidism is a common condition in older cats and is caused by an overproduction of thyroid hormones, leading to symptoms like weight loss, restlessness, and an enlarged thyroid. Treatment options include methimazole, which helps block the production of thyroid hormone, or thyroidectomy to remove the overactive thyroid tissue. Hypothyroidism option B would result in opposite clinical signs, such as lethargy and weight gain, and would show low levels. Hypercalcemia option C and diabetes mellitus option D present with different clinical signs and blood work findings. Question 22. A 2-year-old mixed breed dog named Rufus is brought in for a routine checkup. The owner mentions that Rufus has been excessively licking his paws and appears to be itchy all over his body. On examination, you notice alopecia on the feet, ear canal inflammation, and erythema. Rufus also has a history of seasonal allergies. What is the most likely cause of his symptoms and how should you proceed with treatment? A. Allergic dermatitis. Initiate antihistamines and consider immunotherapy. B. Flea allergy dermatitis. Start flea prevention and corticosteroids. C. Fungal infection. Begin antifungal treatment and culture for pathogens. D. Bacterial pyoderma. Initiate antibiotics and topical antiseptic therapy. Answer A. Allergic dermatitis. Initiate antihistamines and consider immunotherapy. Explanation. The most likely diagnosis is allergic dermatitis, as the dog has a history of seasonal allergies and presents with common signs of allergic reactions such as itching, alopecia, and erythema. Allergic dermatitis can be treated with antihistamines, corticosteroids, or immunotherapy. Allergy shots to control the immune response. Flea allergy dermatitis option B is a possibility, but the lack of a strong history of flea infestations makes this less likely. Fungal infections option C and bacterial pyoderma option D could present with similar skin lesions, but the presence of erythema and a history of allergies makes allergic dermatitis more likely. Question 23. A 12-year-old Dachshund named Otto is presented with a history of back pain, reluctance to move, and incoordination in the hind limbs. On physical exam, Otto has a hunched back and is sensitive to palpation along the lumbar spine. Neurologic examination reveals ataxia in the hind limbs. What is the most likely diagnosis and how should you proceed with treatment? A. Intervertebral disc disease. I'd recommend strict rest and pain management. B. Degenerative myelopathy. Begin a supplement regimen with antioxidants. C. Hip dysplasia. Initiate joint supplementation and NSAIDs. D. Spinal cord neoplasia. Recommend MRI and biopsy. Answer A. Intervertebral disc disease. If recommend strict rest and pain management. Explanation. The clinical signs of back pain, reluctance to move, and hind limb incoordination in an older Dachshund are highly suggestive of intervertebral disc disease IVT, which is common in small breeds with long backs. The appropriate treatment involves strict rest, pain management with NSAIDs or steroids, and possibly surgery if conservative management. A successful degenerative myelopathy, option B, could present with hind limb ataxia, but it typically progresses more gradually without the acute back pain seen in this case. Hip dysplasia, option C, would cause lameness and joint pain, but it wouldn't explain the spinal issues observed here. Spinal cord neoplasia, option D, is a more serious concern and would require advanced imaging for confirmation. Question 24. A 6-month-old Labrador Retriever named Charlie presents with a history of diarrhea and vomiting. The owner reports that Charlie is also lethargic and has a decreased appetite. Blood work shows low platelet count and fecal analysis is negative for parasites. What is the most likely diagnosis and what is the next step in treatment? A. Parvovirus infection. Initiate supportive care with Romanoids and antiemetics. B. Canine distemper. Recommend supportive care and antiviral therapy. C. Giardia infection. Administer deworming medication. D. Kennel cough. Recommend isolation and a course of antibiotics. Answer A. Parvovirus infection. Initiate supportive care with Romanoids and antiemetics. Explanation. Parvovirus infection is the most likely diagnosis in this case due to the clinical signs of vomiting, diarrhea, lethargy, and the low platelet count, which is common in parvovirus infections. The next step in treatment is supportive care, including Romanoids to prevent dehydration, antiemetics to control vomiting, and possibly antibiotics to prevent secondary bacterial infections. Canine distemper, option B, would usually present with additional respiratory signs and a more progressive course, while Giardia, option C, typically causes more chronic gastrointestinal signs. Kennel cough, option D, typically presents with a cough and upper respiratory symptoms, not vomiting and diarrhea. Question 25. A 3-year-old Doberman Pinscher named Zeus is presented with a history of sudden onset of hind limb weakness, difficulty walking, and excessive panting. On examination, Zeus has a rapid heart rate and weak peripheral pulses. Blood pressure is low and an ECG reveals a Y-complex arrhythmia. What is the most likely diagnosis and what should be the next step in treatment? A. Dilated cardiomyopathy. Initiate antiarrhythmic therapy and consider hospitalization. B. Hyperkalemia. Administer calcium gluconate and sodium bicarbonate. C. Hypovolemic shock. Recommend Romanoids and vasopressors. D. Acute myocardial infarction. Recommend thrombolytics and emergency surgery. Answer A. Dilated cardiomyopathy. Initiate antiarrhythmic therapy and consider hospitalization. Explanation. Dilated cardiomyopathy, DCM, is a common cause of sudden onset weakness and arrhythmias in large breed dogs like Doberman Pinschers. The Y-complex arrhythmia seen on the X suggests an underlying cardiac issue, such as DCM. The most appropriate treatment includes antiarrhythmic drugs, such as lidocaine or sotalol, hospitalization for monitoring and supportive care. Hyperkalemia, option B, can cause arrhythmias, but it typically presents with different ECG findings and would not explain the sudden onset of weakness. Hypovolemic shock, option C, could cause weakness and low blood pressure, but would not explain the arrhythmia or ECG changes. Acute myocardial infarction, option D, is rare in dogs and would not typically present with the Y-complex arrhythmia seen. Question 26. A 4-year-old male domestic short-haired cat named Felix is presented for a sudden onset of vomiting, lethargy, and decreased appetite. The owner reports that Felix has been urinating more frequently than usual and has been drinking large amounts of water. On examination, Felix is dehydrated and his breath has a sweet, fruity odor. Blood work reveals elevated blood glucose and ketones in the urine. What is the most likely diagnosis and what is the next step in treatment? A. Diabetes mellitus. Initiate insulin therapy and provide Romanoids. B. Acute kidney failure, begin fluid therapy and assess renal function. C. Hypothyroidism, begin antithyroid medication. D. Liver disease, start hepatic support therapy and monitor liver enzymes. Answer A. Diabetes mellitus, initiate insulin therapy and provide Roman fluids. Explanation. Felix's clinical signs, increased thirst and urination, lethargy, vomiting, fruity breath odor, are highly suggestive of diabetes mellitus, specifically diabetic ketoacidosis (DKA). The elevated blood glucose and ketones in the urine further support this diagnosis. The next step in treatment is insulin therapy to regulate glucose level, along with Romanioids to correct dehydration and electrolyte imbalances. Acute kidney failure, option B, would typically present with different clinical signs and would show altered renal function on blood work. Hypothyroidism, option C, and liver disease, option D, would present with different signs and diagnostic findings. Question 27. A 7-year-old golden retriever named Max presents for a sudden onset of lameness in the right forelimb. The owner reports that Max was playing fetch earlier that day and has been limping since. On physical examination, there is swelling and pain on palpation of the elbow joint, and Max appears reluctant to extend his leg fully. Radiographs reveal osteophyte formation and joint space narrowing in the right elbow. What is the most likely diagnosis, and how should you proceed with treatment? A. Elbow dysplasia, recommend joint supplements and NSAIDs for pain management. B. Hip dysplasia, start joint supplementation and NSAIDs. C. Fractured humerus, refer for orthopedic surgery. D. Bicipital tendonitis, recommend rest and corticosteroid injections. Answer A. Elbow dysplasia, recommend joint supplements and NSAIDs for pain management. Explanation. Max's clinical signs and radiographic findings are consistent with elbow dysplasia, a common condition in larger breeds that involves abnormal development of the elbow joint, leading to arthritis and pain. The treatment for elbow dysplasia typically includes joint supplements to support cartilage health, NSAIDs for pain and inflammation, and weight management to reduce joint stress. Hip dysplasia, option B, involves the hip joint, not the elbow, and would present with different clinical signs. A fractured humerus, option C, would be more acute, with significant pain and possible crepitus on palpation. Bicipital tendonitis, option D, could cause front limb lameness, but the radiographic findings here are more indicative of joint disease rather than soft tissue injury. Question 28. A 6-year-old male boxer named Duke presents for evaluation after a recent weight loss, increased thirst, and increased urination. The owner mentions that Duke has been vomiting intermittently and has a reduced appetite. On examination, Duke is mildly dehydrated and has a palpable mass in the abdominal cavity. Blood work reveals hypocalcemia. What is the most likely diagnosis and what is the next step in treatment? A. Lymphoma, recommend abdominal ultrasound and fine needle aspiration for biopsy. B. Addison's disease, initiate corticosteroid therapy. C. Pancreatitis, begin supportive care with Romanioids and antiemetics. D. Renal failure, begin fluid therapy and assess kidney function. Answer A. Lymphoma, recommend abdominal ultrasound and fine needle aspiration for biopsy. Explanation. Hypocalcemia, along with Duke's symptoms, weight loss, increased thirst, vomiting, and a palpable abdominal mass is highly suggestive of lymphoma, particularly in a breed like the boxer, which is predisposed to developing lymphosarcoma. The next step in treatment would be to perform an abdominal ultrasound and possibly a fine needle aspirate. Biopsy to confirm the diagnosis. Addison's disease, option B, would typically present with different symptoms such as lethargy and gastrointestinal issues and would not cause hypocalcemia. Pancreatitis, option C, could cause vomiting and decreased appetite, but it would not typically cause hypocalcemia. Renal failure, option D, would more commonly present with elevated creatinine and bun levels, not hypocalcemia. Question 29. A 3-year-old male beagle named Charlie is brought in with a history of coughing, nasal discharge, and lethargy. The owner mentions that Charlie has been having difficulty breathing and appears to have increased respiratory effort. On physical exam, Charlie has a fever, nasal discharge, and crackles on lung auscultation. Chest radiographs reveal consolidation of the lung tissue and a thickened bronchial pattern. What is the most likely diagnosis and what is the next step in treatment? A. Pneumonia, begin antibiotics and supportive care with oxygen therapy. B. Canine influenza, initiate antiviral therapy and isolation. C. Heartworm disease, start treatment with doxycycline and ivermectin. D. Feline asthma, start bronchodilators and corticosteroids. Answer A. Pneumonia. Begin antibiotics and supportive care with oxygen therapy. Explanation. Charlie's clinical signs: coughing, nasal discharge, fever, and crackles on lung auscultation, and the radiographic findings of lung consolidation suggest pneumonia, which is an infection of the lung parenchyma. The appropriate treatment involves broad-spectrum antibiotics to address the bacterial infection, along with supportive care such as oxygen therapy. Help with respiratory distress. Canine influenza, option B, could present with similar respiratory signs, but pneumonia is more likely diagnosis based on the radiographs and clinical presentation. Heartworm disease, option C, primarily affects the heart and lungs, but would not typically present with this degree of acute respiratory distress in consolidation on radiographs. Feline asthma, option D, is condition affecting cats and with wheezing and bronchospasms, not the lung consolidations seen here. Question 30. A 10-year-old female Cocker Spaniel named Daisy is presented with a history of chronic ear infections, head shaking, and scratching at her ears. On examination, Daisy has erythema and discharge in both ear canals, and she reacts with pain when her ears are palpated. The discharge is dark and foul-smelling. What is the most likely diagnosis, and how should you proceed with treatment? A. Otitis externa. Initiate cleaning and prescribe topical antifungal or antibiotic therapy. B. Hematoma of the ear flap. Recommend surgical drainage. C. Foreign body in the ear canal. Attempt removal under sedation. D. Hypothyroidism. Begin thyroid hormone supplementation. Answer A. Otitis externa. Initiate cleaning and prescribe topical antifungal or antibiotic therapy. Explanation. Daisy's signs, including chronic ear infections, erythema, and foul-smelling discharge, are typical of otitis externa, an inflammation of the external ear canal. Treatment involves cleaning the ear canal to remove debris and administering topical antifungal or antibiotic medications depending on the cause of the infection, bacterial. Fungal hematoma, option B, would present as swelling in the ear flap, not with discharge from the ear canal. Foreign body, option C, might cause similar signs but would be more localized to one ear and would require removal under sedation. Hypothyroidism, option D, could predispose to skin and ear infections but would typically present with other signs such as weight gain and lethargy and would not be the primary diagnosis in this case.